Welcome again back to the wellness segment here on the program Fresh with Dr. Norman Bryan and Dr. Anjana Gupta, and we are talking dental medicine again, and we're going to talk to Dr. Gupta in just a little bit about some cancer screening that goes on here in the office in Elkhart. But first, I want to talk to Dr. Bryan about what we can expect in the coming weeks, Doctor, and good morning to you. You're going to be talking about some vertical dimension and still following up a little bit with sleep apnea and snoring, that kind of thing, aren't you?
That's correct. I'd like to kind of inform the public today about vertical dimension, which is the chin-to-nose ratio, what we call dental aging. It's a situation where people may have missing teeth, they may be mouth grinders, various reasons, overbites, that sort of thing, where we see the actual chin-to-nose ratio drop. And that is, of course, involved also with TMJ, sleep apnea, plus obviously the cosmetic issues. And it's something I think we need to educate the public about. They may see it in their spouses, they may see it themselves, and certainly they may see visually what this means. We'll try to go over that with them and explain what we can do and just give them some basic information on this issue.
Another topic that goes well beyond just the care of teeth, right?
Oh, most definitely.
All right, Doctor. Looking forward to it.
Thanks, Greg.
Dr. Norman Bryan and Dr. Anjana Gupta here, and today's topic, not a pleasant one necessarily, but one that's very important, isn't it, Doctor?
That's right, Craig. Unfortunately, it's not a pleasant topic, but it's one that needs to be addressed, and that is oral cancer. We're seeing a rise in oral cancer in the last several years, and I think it's a subject that needs to be touched on and the public needs to know about it. So we're going to get into that today.
All right. Well, we're going to step into the dental hygiene room and take a look at some of the screening equipment and instruments that are used here in the office. Well, here we are inside the dental hygiene room inside the offices of Dr. Norman Bryan and Dr. Anjana Gupta, and talking about oral cancer. And Dr. Gupta, can you just kind of lay the foundation here a little bit for us? What exactly is oral cancer?
Sure. Oral cancer is just like cancer in any other part or any other region of your body. The oral cavity and the head and neck are other parts of your body that need to be screened for cancer, just like breast cancer, cervical cancer, prostate cancer. The oral cavity and the head and neck are parts of the body that fall into the realm of the dentist. It's not really the physician that's going to be looking inside your mouth on a regular basis. It's your dentist. So most people, think, why is a dentist looking for cancer? Well, unfortunately, the oral cavity and the tissue inside the mouth are places where cancer can be found. It's a cancer that unfortunately is on the rise. We're seeing an increase in oral cancer due to two things, basically. One of them is that we're seeing an increase in the HPV virus, human papilloma virus, and it's just recently been shown that there is a strain of this HPV that is associated with oral cancer, the same strand that is associated with cervical cancer. A comparison is the Pap smear. The Pap smear is an oral cancer screening that women are supposed to have done every year to show any form of cancer or precancerous cells. That's basically comparable to oral cancer. We can see changes in the oral mucosa that could lead to different types of oral cancer. And I think the problem is that we're not seeing enough diagnosis of oral cancer. Patients aren't aware of the situation, and as dentists, it's our responsibility to be looking for that because we're the ones that are examining your head and neck and your mouth on a bi-yearly basis.
There are a couple of instruments, if you will, that you use here in the office to diagnose or to maybe look a little bit further at what could be a cancer spot. Could you talk about those two?
There sure is, Craig. The exciting thing is that there's new technology in the dental field in regards to oral cancer because this is such an issue, an issue that we know we need to address. Obviously, when dentists are doing an exam, they should be feeling the head and neck for anything abnormal, lumps or bumps or anything that's tender. They should be doing a visual exam of the tissue inside your mouth just with their naked eye. Unfortunately, before the last year or so, that was the only technique we had to diagnose oral cancer. Now, something that we've implemented in our office is called the Velscope, and it's a really inexpensive, less invasive way to detect oral cancer. All it is a handpiece with a blue light that shows the natural fluorescence of the tissue. So when I look in your mouth through this light, I'll see all regular normal fluorescence, unless there's an abnormality or a change in the tissue. That will show up very clearly to me in the mouth that there's been a change in the tissue. Then I can address that issue, whether I want to do a biopsy or monitor it. At that point, it's up to me to make a decision as to how I want to treat it. This picture here shows a nice example of what I see when I'm looking through the Velscope. Here shows somewhat normal tissue, and here you can see how there's a black lesion here under the light. In what normal tissue, that you can't really see that there with the naked eye. That might be something that gets missed by a doctor or a dentist or a patient. So when we're using an instrument like the Velscope, it shows up very clear and very easily. And this is a lesion that, if caught early, could be removed, precancerous cells gone, and the patient has a much less chance of having any further oral cancer.
So that's the Velscope, and you used the Velscope on me, and again, it was painless and very quick, and like you say, inexpensive. What about the other tests that you use at times?
Well, depending on what we find, if we find a lesion that we think is worthy of having a biopsy, we may send you directly to the oral surgeon to have a incisional biopsy done or a scalpel biopsy. But most of the time, what we're looking for is lesions that are small enough that we can do what's called a brush biopsy. That's a very easy biopsy. We do it right here in this office. It's a little bristle brush that we just rub several times on the lesion. We put it on a slide and send it to a lab, and it comes back with a diagnosis. So it's letting us know that either that lesion was totally normal tissue, and it'll probably be gone in a week or two, or there was some dysplasia there. There was some change in those cells that may warrant further, diagnosis or further treatment, which may be a biopsy, removal of the lesion, again, maybe just monitoring. It just depends on the lesion or the type of cells that are found.
Well, doctor, those watching at home, what should they be looking for? If what they've heard here may ring a bell a little bit or touch a nerve, as it were, what should they be looking for?
Well, it's easy to look, in the mirror, first of all, in your own mouth. But what you really want to do is see your dentist. If you're seeing your dentist on a regular basis, ask them. Ask them to do a cancer screening if they're not doing one. Ask them to take a closer look. Here in our office, you get the Velscope every time you're here for your routine exam. It's only charged out once a year here in this office, but we think that it's such a helpful piece of equipment that we do it on every patient every 6 months, regardless of their background, because we're seeing that 35% of the cancers found are they are in non-smokers and non-drinkers.
Isn't that something?
Yeah. Wow. So it's really important that the entire public be aware of the situation. So,
well, very good information. Again, a topic that we don't like to talk about, but as we say, it is important. And
right.
What you need to do is, like Dr. Gupta said, go to your dentist, ask for that screening, and if they don't have it, well, this would be the place to go. Certainly, you can find out more information when you go to our website at myfresh.tv, and you can link on to the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta.